all day, but let me stop. Okay. Well, hello everybody. Hello everybody. We're gonna have a great time. As you can see earlier on, we were talking about a lot of different things as everyone was coming in. We're talking about Brooklyn, we're talking about Baltimore. But we have another topic to talk about. If you didn't know, it's Black History Month. It's Black History Month. That's number one. Okay. Happy Black History Month. Okay, y'all. So that's number one. And number two, if you didn't know, we have a lot of different events happening this month. Okay, y'all. A lot of different events happening this month. If you didn't know, we have different fitness events happening in different cities. We have different webinars with our medical advisors. So we're gonna get like loads and loads and loads of information. It's like some good information. Okay. So if you didn't know, get all of your like get everything. Put it on your calendars at this point. Put everything on your calendars because we got a lot of information for y'all. But in all, I just want to say thank y'all for coming in. And today we have Dr. Swiner, who I love so much. Okay, we saw each other in person at Howard's homecoming, and we had a great time. Okay, and I know you can agree because we had a great time. So I'm gonna have Dr. Swiner come in, introduce herself, just in case if you didn't know. But if you do know, you already know she's full of information. She's just a good time, just a great person to talk to. Okay. You just feel like you can really just open up and just talk to her. So, Dr. Swiner, go ahead and just let the people know who you are. Okay.
Not a good time. Yes, we are a good time. Hi, Jessica. Hi, PB family and team. I am Nicole Swiner. Welcome, welcome, welcome. Shout out to everybody who's tuning in, all the states, all the cities, all the cultures representing. I think I saw Canada in the house. Welcome. Shout out to Chucktown, Charleston, South Carolina, Summerville, South Carolina, Manning. I am a Charleston girl, Goose Creek represent. That's where I'm born. That's where my family is from. My husband's from the DMV. Yes, much different cultures, Jessica. He would be very offended. Not offended, no. Love Baltimore, love the DMV, but he is from DC, which is how we got connected through Howard Homecoming. Oh, I see my home city, my hometown now, Durham, North Carolina. So shout out to North Carolina. So everybody's here. I love it. I love it.
Oh, we.
Yes. Oh, somebody said their dad's from Goose Creek. We're probably family. We'll talk later. All right. Well, welcome again. I am Nicole Swiner, also known as Doc Swiner, on social media, and I am one of the three beloved medical advisors for this wonderful Black Girl Vitamins team for almost a year or so now, or ish. I don't know, like 6, 8 months. I love it. For however long it's been, I've really enjoyed being with a team of just wonderful Black women. Number one, period, right? Happy Black History Month. Number two, being part of a team that is truly committed to the education of medical health and wellness for the Black community. Wonderful. And because I'm a family doc, I'm a board certified family physician, health and wellness is my jam, particularly for Black women. And I love sharing the good news of how to take care of yourself and how to do all the good things that you need for health. But are we doing all right with our broadcast? I'm looking at the screen. I'm like, what's going on?
I think we're good. Can you see?
Okay, just want to make sure.
That was stuck. Okay.
Okay.
You
Might be
good.
a little stuck. All right, I still see people in the chat though, so we didn't lose anybody. Good.
Okay, yeah, no. They
Excellent.
blowing it up. We love it, right?
Yes. If you are joining me for the first time, like I said, I'm a board certified family physician, so I talk about anything from start to finish and everything in between. So I see from babies fresh out the womb all the way up to elderly and geriatric patients, but I love focusing on the family in the middle, the growing family, so parents and their kids growing up, being healthy, helping to talk about developing families and what that means, purely for women as they move through their fertility issues and their GYN issues and mental health issues and all those things that come with just being a woman. So that's what I like to focus on. And today we're going to talk about a huge topic that is involved with GYN and gynecology and obstetrics, which are fibroids. And I know a lot of us have dealt with them. Unfortunately, Black women have definitely deal with, just like we deal with most things, on a higher level, and a worse level than a lot of folks in other categories and demographics. So fibroids is a very, very important topic that we'll talk about today.
Absolutely. And just from like my own personal experience, my auntie, she actually did, and I actually had no idea because I seen it was as if like it was her stomach, and I was just like, what is going on? I'm like, I don't know. And then I heard she had to get surgery, and I'm just like, I have no idea. So this is definitely something that I had family experience as well. So just very interested in learning and just knowing more. So
Yeah, and it's definitely, unfortunately, also a genetic issue, right? So it's important to know that your aunt, if she's blood related,
mhm,
if she dealt with it, how she dealt with it, because that may be helpful for you down the line. So we have to also share our family history, guys. I know a lot of folks in our beloved culture don't always share what's going on with us, what happened to our grandmas and aunties, et cetera. But it's very important because we may need that knowledge down the line to take care of our own bodies. So.
definitely, definitely. All right, y'all. So we're about to start with the first question. And also, if you have any questions, please make sure that you put it inside the chat as well. We will definitely be answering and asking as well. And also, as you guys are coming in, please mute. Just make sure you're muted just to make sure that, we're able to hear Dr. Swine and everything and all the good information that she's going to tell us, okay? And make sure y'all share this with people. Make sure that you let people know because this is information that is definitely needed for us to know and just to learn about, okay, y'all? Okay, so first question. So, what exactly are fibroids and how do they develop? That's number one. And then, are there different types of fibroids and do they affect, do they have different symptoms as well?
Yes. So fibroids, if so, let's back up a little bit. So your uterus, right, your womb is usually shaped, a non-pregnant uterus is usually the shape or the size of your fist. All right, so everybody make a fist. That's the inside of your uterus, inside of your womb, a non-pregnant womb. When you're pregnant, it grows, right, like 10 or I mean, it goes all the way up to like 20 or so, 30 centimeters up into your abdomen and into your diaphragm when it's full, when you have a baby, etc. Um, this is the space though that is it's all muscular. It's smooth muscle. And inside of it can grow different things, including muscular tumors, which are called fibroids, or a leiomyoma, if you that's the fancy word for them. We can grow fibroids both inside the uterus, inside the open space, and we can grow them outside of the uterus or on top of the uterus. But they are benign collections of muscle. They just decide they want to grow in a certain space. So your body decides, yes, I want to implant more muscular tissue here. So that's where I'm going to grow this lump. That's what a fibroid is. Usually not cancerous. That's why we call them benign. But we call them tumors because they're still not supposed to be there, right? So a tumor is something that grows usually from normal tissue, but it's a size that it shouldn't be, or it's in a place that it shouldn't be. Not all tumors are cancerous, thankfully, and fibroids are in that category. So that's what a fibroid is. Are there different types of fibroids? I would say, there are different types in terms of size, shape. Some of them have calcium, some of them don't. But in general, fibroids are essentially the same. They just grow at different rates, or they may have more calcified tissue than others, or they may have necrotic tissue depending on how long they've been there, if they're shrinking or dying down. Sometimes they have different types of tissue. But in general, fibroids are the same. Do they affect symptoms differently? Absolutely. And that usually depends on the location of the fibroid and the size. So let's think again. If you have a fibroid that is inside the opening, the cavity of the womb
Mhm.
during your period, it's going to cause more pain and more bleeding, right? Or even when you're not on your period, you might have excessive bleeding or cramping. If you have a fibroid that's sitting here at the opening near your cervix, it gets in the way potentially of pregnancy or a viable pregnancy or a pregnancy that can grow and expand because it's in the way. If you have one that, let's say, is on the back of your uterus near your rectal area, that's going to get in the way of your GI system. It's going to push up against your intestines and maybe cause you to feel constipation, or it's going to cause you to have trouble when you're trying to move a bowel movement. So it all depends on the size and the location as to how the type of symptoms that you're experiencing. If you have really, really heavy vaginal bleeding from fibroids, you have low blood, you're going to have low blood count of your iron, you're going to have anemia. So you're going to see that show up in your blood work as having a low hemoglobin and hematocrit because you're bleeding heavier or bleeding outside of the times that you should normally be bleeding. So those are kind of the main symptoms that you'll find when it comes to fibroids. Now, not everyone will have symptoms because fibroids, again, if you have a really small one, even if it's one or two small ones, you may not know it's there until you end up having an ultrasound for another reason, whether it's because of pregnancy or you have, cysts on the ovaries and you're getting an ultrasound because of another reason. You may see that you may have a couple of fibroids, but if they're really small and not really active, you may not know that you have them at all. So yeah.
Hey guys, please make sure that you guys are muting as well. So go ahead, Dr. Swiner.
Yeah, that was it. I was just saying, I just wanted to also highlight that not everyone knows they have fibroids because not everyone will have symptoms if they're really small or they're not really active. You may just happen to see them on an ultrasound if you have an ultrasound done for a different reason.
Mm. Oh wow. So actually, no, that explains a lot of different things and just why, because no, okay, this is definitely information that we need. Someone did ask in the comments, does sugar affect the amount of sugar that you have, or just sugar in general, does it affect fibroids?
Absolutely. And I think we have a question about
Yeah.
diet and how
Mhm.
that affects fibroids as well. But yes, the short answer is yes, and we'll talk more about that.
Got it. All right, y'all. So, as well as if you have any questions, please make sure that you guys are putting it in the chat. And as you guys are entering in, please make sure you mute so we can have as much, just have all ears listening to what Dr. Swiner is telling us because we really do. This is information that we're getting from a medical advisor, our medical advisor. So, yes, this is definitely something that for me personally, I've with my auntie as well. So, y'all. What are the most common symptoms of fibroids, and how can someone tell if their symptoms are due to fibroids or another condition?
Yes. So I touched a little bit on this in the previous question, but if you think about it, right, it makes sense. If you have extra tissue inside the uterus or outside the uterus, your uterus having to do mostly with bleeding and menstrual changes and pregnancy, almost anything related to that is going to be related to a fibroid. So pelvic pain, worse cramping than usual, heavier bleeding during your period, bleeding outside of your period. I mentioned depending on the location of the fibroid, depending on the size of the fibroid, these things can get pretty big, by the way. They can get up to, 10 centimeters or so. That's like the size of a baby's head when it's crowning, which is crazy to think about. But depending on the size of the location, you can kind of think about how it would cause problems. So I mentioned if it's one that's located in the back of the uterus, because that sits up against the rectal and intestinal area, that's going to potentially affect your digestive system and the movement of your bowels. Anemia, low iron, because you're bleeding too much and things of that nature. Fatigue, if you've been having anemia, you can think how all the things are interrelated there. How can someone tell if their symptoms are due to fibroids or another condition? It really just is about paying attention to your own body, paying attention to your cycles, having those open conversations with your primary care, with your women's health and your OBGYN physicians to say, something just doesn't feel right. If you've been having fertility issues, if you've been trying to get pregnant and you've had miscarriages and things of that nature, you definitely want to bring that up to them and say, hey, have we done an ultrasound? Have we checked my estrogen and progesterone hormone levels? Have we checked my thyroid? Let's think about other things that might be getting in the way of me feeling good and feeling like a normal human being, right? Yeah, I see y'all's comments are really good. I have PCOS. PCOS is different than fibroids. PCOS is polycystic ovarian syndrome. So that's you have your womb, the fallopian tubes look like little bull horns. At the end are the ovaries, and you can develop cysts on the ovaries. So that's separate from fibroids.
Got it, y'all. Okay. Make sure that you guys keep putting questions in there as well. Please, 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 y'all. Please, y'all, please, y'all, please. Okay. Now,
Yes.
Dr. Miner. Yeah.
Ah,
Yeah. This is so good.
Just that other question someone asked, the follow-up question was, can women have both? Yes, women can have both fibroids and PCOS. Absolutely. And again, sometimes it's as, I don't want to say as simple as, but it's as simple as having an ultrasound because you can see that stuff on an ultrasound.
Mm. And even with having fibroids and PCOS, is that genetic or is that something that we can prevent as well? So,
Yep, absolutely. So, having fibroids can be genetic. Having PCOS can be genetic because it's all hormone related, passed down through the moms. So, yes, you can.
mm, all right, y'all. So we're going to the next question. Please make sure that you're also asking questions inside the chat because we are reading it off the chat as well.
Yeah.
So what causes fibroids to grow and why are they more common in Black women? Because that's something that I have heard a lot. I feel like anytime I hear about fibroids, I've always heard it within Black women majority of the times. And I'm just like, why is that the case? And then this is a full loaded question. Why do Black women experience fibroids more frequently and more severely than other groups? And are there genetic or environmental factors that contribute to fibroids in Black women, which we did talk about a little bit too?
Yes. Yes. So, what causes fibroids to grow? I've seen you all putting good questions in the chat and good comments in the chat about hormones. It's all about hormones. Anything that causes more estrogen
Mhm.
causes more fibroids to grow, right? So estrogen and progesterone are kind of our two main hormones that balance each other out. Black women tend to have higher estrogen levels earlier in life, whether it's because of stress, genetic issues, external hormones, meaning things that, increase our estrogen level, like taking birth control or other types of hormones in the foods that we eat. Like I said, later we'll get to a question that talks more about diet, but there are things in our diet that increase estrogen. There are things in the products that we use, knowingly and unknowingly. There's been a lot of talk, or there had been a lot of talk in the past years, particularly about hair care products,
Yeah,
relaxers,
I
right?
I saw that.
I am part of the relaxer crew, right? But
Yeah.
there are some theories about the stuff that we put in and on our bodies that enhance the development of estrogen and not in a good way. So those types of things can cause fibroids to grow. Stress. If you missed the talk that we did a couple of weeks ago, we talked a lot about stress and cortisol, cortisol being another hormone that our body needs, but if we have too much of it, it's not a good thing. It can cause the growth of fibroids. So we have to look at, are we eating a healthy, balanced diet? Are we reducing the amount of external substances that we know that are unhealthy for us? Are we exercising? Are we at a healthy weight so that we don't increase the growth of things that aren't supposed to be growing? Okay. Why are they more common in Black women? I think you can kind of, take what I was saying before and make it make sense for Black folks. We generally have much more stress than everybody. That's why this year I'm definitely trying to focus on this being the year of revolutionary wellness, where particularly Black women, we take our comfort and calm and self-care back and we just deep breathe through these moments, right? Don't let your cortisol get the best of you. Don't let these stress hormones take over your life. Focus on wellness and really let the world do what it's going to do. Okay? Because we don't have time. We literally don't have time to be
Mhm.
dealing with everybody's problems. Okay. But that's why, because we're not really focusing on the things that we should be to help feel better in general. And then specifically for fibroids, we're not really focusing on getting those checkups that we should be because we're so busy. We're caring for everybody and being superwoman for everybody else. We forgot, oh, you know what? It's been about 2 years or so since I had my checkup, since I had my pap smear, since I had this and that. Let me go in and get checked. After a certain size inside the uterus, you can see it and feel it from the outside, right?
Mm.
I think you mentioned your aunt. You said you were looking at her like, her
Yeah, I
body's changed.
thought she would. Yeah, like I was literally, it looked as if there was a baby. So I
Yeah,
was
I was
just
gonna say you can look pregnant. You can look pregnant.
like, she was like, yeah, she had to go get surgery. And I was just like,
Right. That's
okay.
right. So again, because the uterus, a non-pregnant uterus is about the size of your fist, it stretches, right? It moves, it grows and enlarges. And if there's a baby in there, or if there are 5 huge fibroids in there, it has to stretch so it can hold it. And that looks it looks full, it looks enlarged. When you're lying down on the exam table and your doctor is pushing on your stomach and feeling around, or while doing the pap smear and feeling your uterus, they can feel the enlargement. They can feel that there are growths there. And so you got to go get your physical exams, because even if you don't know it, you could have one growing and you don't really notice it because it's not really giving you symptoms, but your doctors can feel it when they're doing your exams. So we got to make sure we're doing our thing. Let's see. Are there genetic or environmental factors? So yes, I think I kind of wrapped the answer all in one, but yes, there are genetic and environmental factors that we need to be aware of. Got to cut back on the smoking, got to cut back on the alcohol, got to cut back on the chemicals that we're putting in and on our bodies, because all those things can increase our estrogens and cause growths. Yeah.
Mm. And I think one of the biggest things I've heard is hormones, right? And just being able to manage. But are there natural ways to like manage your hormones so it won't affect the rest of your body?
Yes, yes, we talked a little bit about that during the stress and the cortisol talk, but exercise, exercise, exercise. Can't say it enough. Exercise.
Lifestyle.
Getting those bad endorphins off you, getting the good endorphins flowing, decreasing your cortisol and increasing your adrenaline in good ways. We don't want too much adrenaline because, like Jessica and I were talking about with coffee, you won't be able to sleep. But you need that, right? Um, what else? Oh, sleep. You need good quality, good hours of sleep. 6 to 8 hours of sleep every night, unbroken, hopefully. Maybe you have to get up to use the restroom once, but good sleep decreases your cortisol, decreases the bad hormones so that your body can rejuvenate and rest. Okay, someone said, is juicing and cutting back on meat helpful? Absolutely. The more fruits and vegetables, we'll talk about specifically the types of vitamins that help to decrease fibroids, will help. But yes, the more fruits and vegetables, the less red meat, absolutely. Best thing to do for general health and also for decreasing fibroids. Yeah.
And I
Okay.
think somebody did ask, and I feel like people will touch on this. A lot of the questions that you guys are asking in the chat, we are going to touch on this. So I'm super excited that you guys are asking it. And I'm so excited that we have those questions. But somebody did ask, do they shrink on their own or
They can generally after menopause, because again, what happens in menopause, your estrogen decreases. So
mm,
with menopause, yes, fibroids can shrink. Or if you're on certain treatments, whether it be medications or you've had procedures, I've seen people mention UFE a couple of times. We'll talk about that. Uterine fibroid embolization. That's a type of non-invasive surgery or procedure that you can have that can cause things to shrink. So yes, there are ways to shrink them as well.
got it, y'all? All right, next question. Why are Black women more likely to undergo hysterectomies for fibroid treatments compared to other groups?
Yes, this is a big one. This also culturally is controversial because we do, for almost any medical disorder, end up being diagnosed too late, misdiagnosed, and then when it comes to treatment, we're being offered the most invasive, right? And that is for many, many bioidentical, demographic, cultural reasons. I mean, social reasons. I could talk for days and days and days about those types of things. However, for fibroids, hysterectomies are usually the things that are offered. And hysterectomy, by the way, is removal of the uterus, either with just removal of the uterus and you leave the tubes, or removal of both the tubes and both the tubes, the ovaries, all three tubes, ovaries, and uterus. So you can have a partial hysterectomy or you can have a total hysterectomy. And usually Black women are offered that historically. You could tell, you could ask, your grandmothers and your great grandmothers. Some of them, it was just because the medical world was not very kind to us, and fertilization, issues were on the brains of some providers. They were just like, well, we'll just take the whole uterus and then you don't have to worry about that. But then that meant you couldn't have children. There are biases that are associated with that historically. Nowadays, cross fingers, the racial bias isn't as much of an issue. Hopefully, as we get better and better with opening up conversations and have more physicians of color available that then understand the plight of the Black woman. Hopefully that is not as much of an issue, but it may be also because we're getting diagnosed too late, either waiting too late to be diagnosed or they've just overgrown. And by the time we found them, you had 10 of them that were all 5 centimeters or greater, right? So at that point, really nothing else will help but to have a hysterectomy. So early diagnosis for everything, anything and everything, whether it's cancer, hypertension, or whatever. Early diagnosis is key, so you have to pay attention to your bodies. You have to be getting your annual checkups so that someone can actually put their hands on you and feel. You have to be asking those questions, saying, hey, my periods have been off, I've been having more pain, my stomach is growing, and I'm not pregnant. Should we be doing an ultrasound? Should we be doing an MRI? It's time for that. You should be having those conversations and advocating for yourself and having that talk with your provider so that you can get diagnosed earlier when they're smaller and you have more options for treatment than just having your uterus removed. Okay?
Yeah, and I think the fact that you said that actually advocating for ourselves, I think that's one of the key reasons why we have webinars and our content is full of education because advocating for ourselves is actually we have to do that as Black women because we have to know um what are the things that we notice that's wrong or like there's something off. But sometimes you might have a medical provider who is just like, oh no, nothing's wrong. But you're like, no, 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 I know something is wrong, right? So, and I think the fact that you even talked about advocating for yourself and just having that information and just giving us information and things that you should notice that when you do go to your medical provider, things that you should ask and talk to them, those are things that you should actually bring up to them as well. Even if they're just like, oh no, you're fine. Like I need it. I need
Right.
to.
And one thing I always say, just in general, just kind of as a blanket statement when it comes to having a good patient-provider relationship, if you don't feel like your provider you have good rapport with him or her, or they're not really listening, or they listen, but they're a little too busy and it's hard to get them to focus and to do the things that you feel are needed for your body, find another provider, right? If you're searching specifically for a provider of color, specifically a Black physician, Black provider, whether it's a nurse practitioner or a PA, we do exist. We are out there. It may be harder to find us because we're only 3% of the population. But, now you have Dr. Swiner that you heard from at Black Girl Vitamins. Now you have the other medical advisors. Now, you may have a cousin or a sister or a friend of a friend who is a medical professional. Ask them, hey, I'm looking for a really good provider that's going to listen to my concerns. Can you refer to me to somebody? So don't sit back and wait. You don't have to feel like you're stuck. Unless you're in an area where you really don't have a lot of options when it comes to medical care and healthcare. And there are those places, we call them healthcare deserts, just like food deserts. But if you're able to travel a little bit further to go to a bigger medical system where there are more providers that look like you, that you connect with, if they're available, go and ask them, go talk to them, say, hey, I spoke to so and so, and she encouraged me to ask you about this. You can do that. That's okay.
Mhm. See,
Yeah.
yeah, write it down, you guys. This is definitely information. Still seek if you feel very uncomfortable with your medical provider, please
Go
check
find
them.
one that you are comfortable with.
Exactly. Somebody did ask, and I did see somebody ask a question. If they looking for it. Yes, 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 yes. They said that they were talking to their doctor and they said that they asked the question that if the fibroid is small and their medical provider said, oh, it's nothing to worry about, should they still think about removal?
Not unless it's causing you major symptoms. No, no.
Got
You
it.
don't have to remove fibroids if they're not bothering you. No. So you'll just kind of, keep an eye on them with your physical exams. Again, they can touch and feel, or if you need to do an ultrasound occasionally to keep an eye on the growth, you can. But no, you do not have to treat the fibroids if they are not bothering you.
Got that question. All right, next question. At
Yes.
what age do fibroids typically develop and do they shrink over time? We talked about that.
Yes. Most women will start noticing symptoms or noticing that they have them around their 20s and 30s, generally. And do they shrink over time? Yes, they can, depending on the size. But usually after we stop producing estrogen, which is menopause, they can shrink. Or if you're on particular treatments or you've changed your lifestyle and changed your diet and you're not doing all those unhealthy things, yes, they can shrink. Decreasing your stress, yes, they can shrink.
Okay. Stress. You realize how much stress is connected to so much?
It's connected to everything.
We really have to make sure that we're taking care of ourselves. Like a lot of the webinars that we have, it's really about making sure that you take care of ourselves, take care of yourselves. And that's why even our Black History Month campaign is sisterhood and self-care. So making sure you're caring for self, okay? You do have to put yourself first so then you can take care of others around you, okay, y'all? So self-care. Put you first. It's okay. Y'all, it's
Necessary.
okay. It's necessary. It's needed in order for you to do everything else. Because if we're not the best versions of ourselves, how can we be the best versions for others as well? So
Got it.
take care of ourselves. The systematic racism and healthcare bias impact the diagnosis and treatment of fibroids in Black women.
Yes, I jumped the gun on this one too, but yes, so we talked about this earlier. So historically, again, if you go back and talk to your grandmothers, your great grandmothers, some of them, even without given a choice, had hysterectomies for whatever reason, right? They just took the uterus out and didn't really care about the fact that they wouldn't be able to have children, right? That truly was stemmed in racism and bias and I don't even really have to explain, to this woman, what other options she might have. I'm just go ahead and do it. Maybe she didn't have insurance, so that was her only choice, right? But hopefully, prayerfully, as things have hopefully gotten better over time, right? With the medical knowledge that we all now have, because we can now Google and Wikipedia and WebMD information on our own. And we have more providers that are open to having transparent communication with us about what is really happening. Hopefully that gets better. But you have to know, as a Black woman, what your body is telling you so that you can communicate that to other people that can help you. So, early diagnosis, meaning you've been paying attention, something ain't right. You're anemic all of a sudden, where when you never used to be anemic. Your periods are much more painful. You're feeling more cramping in your back than you usually do. Those are telltale signs that you might need to have somebody take a look at that. When it comes to treatment, now that you all are here, right? So we're going to share great information about the types of treatments other than surgery that are available. You're going to then take that education and you're going to share it. And then you're going to take it and go to your doctors and say, I read this. I attended a webinar with a great family physician, and she said this. So that's how we get better with treatment options, with how to diagnose things earlier, with the sharing of really good educational information, and then spreading it to others. So that's what we will do.
All right, y'all. She got the tea.
I got the tea. Yes.
What diagnostic tests are used to confirm fibroids? Ultrasounds, like ultrasounds and MRIs. What are the
Yep.
different diagnostic
All of
tests?
that. All of that. So the least invasive and the first step is usually ultrasound. So that's putting the probe with jelly, with the warm jelly on top of your abdomen. They kind of move it around and move it around your pelvis, or sometimes they'll do transvaginal, meaning the probe goes inside and they can get a closer look at the uterus. So that is just taking the picture of the uterus and what's on the inside and the outside. A pelvic MRI is when you have to go through the machine. That's a little bit more advanced, a little bit more detailed to get not only the picture of what the uterus looks like and if you have fibroids, but like the details of the fibroid. Like, does it have calcium? Is it necrotic? Has it started to shrink and die off? More specific characteristics about the fibroid itself. Ultrasounds come in different flavors because you can do what's called, and I'm going to say all these things wrong, but essentially there are ultrasounds that you can do with the probe and you're just taking a look, or you can do an ultrasound where they actually flush water, because not only will it show you a regular ultrasound picture, but it will show you the flow and if there is any obstruction to flow inside or out of the uterus because of the location of the size of a fibroid. You can do scopes. They can go up in there with a scope, hysteroscopy, and take a look with a camera as well. So those are the different types of things. But the first line, the first one we almost always start with is a regular old ultrasound. and you can ask for that.
Got it.
Mhm.
Okay, y'all. There's so much information I just didn't know. There's so much.
Yeah, it's a lot. It's a lot of details.
It is. And y'all, we will have a recording on our YouTube. So if you are looking for a recording, it is being recorded and we are going to make sure that you guys get your recording. Okay, y'all? So, yes, we got that for you. Can fibroids cause complications beyond heavy periods and pain, such as infertility or pregnancy issues?
Yes, indeed. So, beyond the heavy periods and pain, I kind of again jumped the gun in the other questions: constipation, anemia, fatigue, other problems with having
Damn,
bowel.
I wish I had my AirPod.
Oh, sorry. Was that you, Jessica?
No.
Oh, I'm sorry. Okay, I thought you were talking. Um, yes, infertility. So again, just thinking about the location of a fibroid, if it's sitting behind the cervix, which is what needs to open up or be closed so that you can have a viable pregnancy to full term or push a baby out, it's going to get in the way of that. Or if you have a big old fibroid that's sitting inside the uterus and is pushing up against the cavity, a baby needs space to grow. It's going to get in the way of that. It's unfortunately going to cause miscarriages. So yes, if your fibroid is big enough and is in the wrong location, it certainly can have or cause problems with infertility and pregnancy. And then, when you do become pregnant, they do ultrasounds. They do them pretty early to look at the sex of the baby and all that. And they can find them then and tell you whether or not it's going to be an issue or not.
Got it.
Yeah.
All right, y'all. Make sure you guys are writing this down. All right, next question is, what are the best treatment options for fibroids? Are there non-surgical alternatives? And what are the chances of fibroids coming back after treatment? That was always my question because I would always see people, they would go through the treatment or they'll get the surgery and then they would have to get it again because it came back. And
Mhm.
it's like, okay, are there ways to prevent it? Are there things that you can do? Or is that just kind of like what it has to be, where it's like, okay, well, they're going to come back. Let's just see how long it's going to take for them to come back.
Yeah. Yeah. So this is definitely the meat, I think, of the webinar because I've seen a lot of people ask about treatments and surgeries and et cetera. So again, first line treatment is always going to be non-surgical, non-invasive, the least invasive thing to do, which of course would be either vitamin supplements or medications. So think about things that would increase your vitamin D, things that would increase your vitamin E, because it's anti-tumor, anti-inflammatory type deal. Your potassium, increasing that, increasing your selenium, which is also good for the prostate. Again, they're all kind of in the same area of the body. They respond to the same types of things. So any vitamins or supplements or dietary things that increases those particular things, vitamin D, vitamin A, vitamin E, selenium, potassium, all good for preventing trouble from fibroids. Okay. So that's your vitamin supplementation category. Medications that can be prescribed include hormone medications. So things that, are related to birth control, things that are related to decreasing your estrogen are things that can be prescribed to decrease the girth and the intensity of a fibroid. If it's pain that you're getting from the fibroid specifically, of course, there are things that can help treat pain, whether it's Tylenol or ibuprofen, anything that is anti-inflammatory that helps with pain. So those are the types of things there. Or procedures which don't have to do with removing the whole uterus include an IUD. Who knew? Getting an IUD implanted, that's the Y or T-shaped little implant that you can have slid into the inside of the uterus, decreases your estrogen level, right? Specifically, if it's one of the progesterone related ones like Mirena, like Skyla. Okay. Yep. An IUD. Someone's like, what? Really? An IUD? Yes.
No, they
IUDs, because they release progesterone and help to bring down your estrogen. Or some people with IUDs stop having a period altogether. That's how they use it for birth control. It decreases the growth of things that are hormone dependent, right? An IUD, Implanon, which is that implant, used to be like Norplant, you get implanted inside the arm. Same deal, increasing progesterone, decreasing estrogen. Okay, so that's that. Now, actual procedures that are done to the uterus include, I mentioned or saw UFE being mentioned often, or UAE, which is called uterine artery embolization or uterine fibroid embolization. A very, very popular procedure where a substance is injected into the blood supply that helps to feed the arteries, right? Or excuse me, helps to feed the fibroids. So you go into your doctor's office. They give you numbing medicine. It's not full out anesthesia, so you're awake, but they give you pain medicine so that you're not uncomfortable, and they inject a medicine. I think it's alcohol based, but they inject a medicine into the arteries that then feed the fibroid to then block the blood supply that causes the fibroid to shrink. That's called UFE or UAE. They can do that inside the office. It's not a surgery, it's a procedure. You go home, and then over time, they monitor and make sure that the fibroids shrink and then hopefully don't cause you problems. Okay. Another one called ablation. Ablation, all these, by the way, disclaimer, are dependent upon the level that you are, right? So it all depends on how many fibroids you have, how big the fibroids are. That will determine if you are a candidate for some of these things, but these are some of the options that you have outside of surgery. Ablation is when they go in and, it sounds horrible, but they essentially scrape, I don't want to say scrape, they thin, let's say that, they thin the lining of the uterus so you don't have as much tissue there to bleed, and hopefully can thin down the size of the fibroids that way. So again, procedure, you go into your doctor's office, they give you pain medicine or not general anesthesia, but local anesthesia so you're comfortable. And they go in and they thin out some of that tissue inside the uterus, which then will hopefully decrease the size of the fibroid. Ablation. Some people get that just with heavy periods. You don't necessarily have to have a fibroid. Ablation is used for a lot of different reasons, but that also is helpful. Okay, I'm making my way up to hysterectomy. What else? You can actually have the fibroid itself or themselves removed without disrupting the uterus. So they can actually go in and do a myomectomy. Myoma is another name for fibroid. Myomectomy, removing the fibroid itself. So again, depending on the size and the location, it all depends. And you have to have that discussion beforehand to see if you're a candidate. They can actually go in and remove the fibroid itself and keep everything else intact. Okay. Then what else? Again, working my way up to hysterectomy. I think there was one more there. Oh, radio frequency. This is actually a pretty new one I heard of, and I might be jumping the gun again with the new stuff, but there's a new radio frequency type of treatment that they can go in with radio frequency and kind of stimulate the fibroid that way, and then it shrinks as well. So again, they're treating the fibroid itself and not disrupting the uterus or removing the uterus. And then ultimately, there is hysterectomy, right? And hysterectomy, when you get to that point, whether the fibroids are huge or you've tried everything else and it's not working, or you are bleeding, bleeding, bleeding more than you're supposed to be bleeding, and you just need to get it taken care of, or you've already had your children and you're okay with, okay, I've had my kids, I'm good, let's go ahead and take this out. Hysterectomy, of course, is the ultimate treatment, because then once you remove the uterus, you no longer have anything that the fibroids can grow in or on. Okay. Lastly, what are the chances of fibroids coming back? I don't have a statistic off the top of my head. Can they grow back if you still have a uterus? Yes. I can't tell you exactly what the chances would be. I would think it would be patient dependent and different for everyone. But as long as you have a uterus, there's that possibility that you could regrow the fibroids. But hopefully, if you had a certain type of treatment, and that, so let's say you did UFE, you did really well with that, and then you decided to go ahead and have an IUD for whatever reason, whether it was also for birth control or contraception, then maybe you could prevent them from growing too large. Or if you had a myomectomy and then you changed your lifestyle,
Think I did this on. Let's make
right?
sure.
You could decrease the chances, or at least decrease the size that the return fibroids would be later on.
All right. Somebody did ask, does ablation affect the risk of getting pregnant, or do these increase any chance of getting pregnant or affect or any of these procedures affect you getting pregnant?
It is possible because, again, you're disrupting tissue, right? And embryos need tissue to implant themselves on so that they can grow. So it is possible. You may have to wait a little bit, let the body kind of recover and rejuvenate, and then start getting pregnant. I won't say that it's not possible at all to get pregnant, but you may have to wait a little bit and let the body kind of recover and get back to its baseline before trying.
Got it. Got
Yeah.
it. Okay. Does diet and nutrition impact fibroid growth? And what lifestyle changes can help manage fibroids?
Yeah. So again, I always jump the gun. I always put I always put all the information like at the front. But yes, diet and nutrition absolutely impact fibroid growth. As we mentioned, anything that's unhealthy, and we all know what's unhealthy at this point. We know that we should not be smoking. Like that's pretty clear. We know we should not be taking in excessive amounts of alcohol. That's clear, just for general health and wellness. We know that we're not supposed to be eating fast food all the time, every day. We know this. Right? But how many of us are truly following those rules on a daily basis, right? So decreasing all the unhealthy things is supposed to help you in all ways, and it certainly will help decrease the growth of fibroids. But if you're looking for things that specifically help with, like, you have fibroids and you want to help prevent them from either growing, or you may even want to help them shrink a little bit, the things that I mentioned before, vitamin D, A, E, selenium, potassium. Those are things that can help with anti-inflammation, anti-tumor growth. Increasing those things in your diet or in your vitamin supplementation. Increasing your exercise and your sleep and decreasing your weight. The heavier we are, the more estrogen we carry, which then helps unnatural things to grow. So getting to a healthy weight, having your lower cortisol levels because you're sleeping well and you're exercising often and you're decreasing stress will help impact fibroid growth, right? Repeat the vitamins again. Absolutely. Vitamin A, E, I skipped D. A, D, E, do them alphabetically.
Yeah.
Potassium, selenium. Those are the big ones.
All right, y'all. ADE, potassium, and selenium.
Yes.
Got it. Got it. Got it. All right, you guys. Are there any promising new treatments which you did talk about
Yeah.
or research on fibroids?
Yes, these radio frequency treatments. I looked it up right before I came in just to refresh my memory. There are different brand names for it, I guess, depending on what company and what equipment the surgeon or the provider is using. By the way, I want to say side note. So when it comes to treatment, diagnosis or treatment of your fibroids, you can have multiple types of doctors. Your primary care, your family physician is one type of doctor that can help you with your fibroids. Your GYN, OBGYN can help you with your fibroids. Your women's health specialist, which might be an OBGYN or a primary care specialist, can help you with your fibroids. A radiologist, an interventional radiologist, can help you with your fibroids. A vascular surgeon can help you with your fibroids. So it doesn't have to just be an OBGYN. Multiple disciplines of medicine now know how to diagnose and treat fibroids, right? So you can go to different types of doctors to do different types of things. We all know about fibroids now. So don't feel like you only have to make an appointment with your OBGYN. You can talk first to your primary care, your family doc, who then, if can your family doc, I'm always going to advocate for family doctors and primary care. Your family doctor could diagnose, they could send you for an ultrasound, they could feel with their hands, they could talk to you about diet and lifestyle, they could prescribe the IUD, they could even put in the IUD, which is what I used to do a lot in clinic, put in IUDs, put in the implantons, prescribe the hormonal control, monitor things. And then once you're at the point where you need procedures and surgeries, then they can send you to the next step, send you to the OBGYN, send you to the vascular surgeon, send you to the interventional radiologist. So again, shout out to my family docs and my primary care folks. Get you a good one. They can do the majority of what you need. And then once you're at the point where you may need to be cut or injected or something else different, then they can refer you on to the next person.
Got it. All right. We just have
Someone said, sorry, was that B or D? D is in dog,
all
is
right.
what vitamin D is in dog.
And if you do
Black
not
Girl Vitamins is a wonderful gummy that I love for vitamin D.
okay, and it tastes great, okay?
I take it every day.
It's amazing, okay? Uh, in this question, we've actually talked about it a lot. Can hormonal balance or stress management help prevent or slow fibroid growth? And you talked about this so
Did.
much.
So yes, 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 and yes. I had a if you follow me on social media, I do an annual women's wellness retreat every year called New Year, New You in Cabo San Lucas, Mexico. We just got back. It was phenomenal. But the speaker that we had, which was a physician herself, talked about her own battle with fibroids. She called them her FBs and her FBettes, her fibroids. Like she'd gotten so familiar with them. They were with her all the time that they were just like, they were part of her lifestyle. But she knew that just the stress of being a Black woman physician in this world, trying to get pregnant and trying to maintain a happy marriage and doing all the things, and because of her family history, she knew she was prone to having more fibroids, and she grew them like crazy. She proved to herself that yes, with decreasing my stress level, decreasing my cortisol level, I can get these things under control. So yes, she did also have to have a procedure, but with the procedure and decreasing her stress level, she was able to get them to a more manageable, tolerable size. So yes, stress is directly connected to that.
Stress.
Someone
Cortisol.
asked about CMOS. Yes, CMOS, because it has some anti-inflammatory properties. I think it would definitely make a difference. It would definitely bring down your cortisol and help in that way as well.
And if you didn't know, we do have sleep loss tablets.
I love CMOS. I take the CMOS too. I love it.
Yeah, okay. We have the tablets and the gummies. The tablets, you can, mix it in your drinks because that's a lot of people don't like to take tablets. But I'm like, you can actually open it up and put it in your drinks if you like to. So if you didn't know that.
Yes, my
Uh,
big three BGV bundle is the multivitamin once a day, the vitamin D, and the CMOS. Those are my go-to.
all right, y'all. You heard it.
You heard
One.
it here first. Maybe
What?
there's not a bundle. We should make a Doc Swiner bundle. What's-
Let me talk to the team about that, you know?
We'll talk about it. Don't worry about it.
How about that? All right. So what vitamins actually, and you really did talk about that, and you can emphasize this a little bit more. What vitamins and supplements support fibroid management and prevention?
Yes, so any of them that can help with anti-inflammation, any of them. And CMOS was a good addition to what we mentioned. So any of those things that we already mentioned decreases inflammation in the body, which would then decrease the growth of things that we don't want to grow. We don't want to grow tumors and extra tissue and muscle we're not supposed to be growing. So that's why the ADE, potassium, selenium, CMOS, all those things make sense.
Okay, y'all. So that was our last question, but we had a full packed webinar, okay? We actually had a really full packed webinar since the time we started. This Dr. Summer White thing. Since the time we started all the way until even now, she has given us more just information, type of information, type of information, y'all. And we will have it recorded. If you follow our YouTube page, you will see it on our YouTube page as well. Okay, y'all. But we do have a surprise and we love to give a good discount. So our discount is Sisterhood 20. If you did not know, we do have CMOS tablets, like I said, right here. You can use the tablets, you can because a lot of people really don't like taking tablets, okay? You can open the tablets, you can put it in your drink, or we have CMOS gummies, and we also have vitamin D as well, y'all. And I just want to say thank you so much, Dr. Swiner. I truly appreciate you for always coming by and just giving us the good details and just information on how we can really take care of ourselves because like I said before, sisterhood and self-care, it's the reason why we kind of had Black History Month. This is our theme or this is our focus because we really have to take care of ourselves. Like that is so important because we're so focused on taking care of so many people around us that we actually put ourselves last. But no, it's time to actually take care of ourselves first so we can make sure that we are good and ready for to take care of everybody else around us. So we just want to say thank y'all so, so, so much. Thank you, Dr. Swiner. Dr.
You're
Swiner,
Good
welcome.
evening.
anything that you want to say to the people? Just wanted to say to our just
Yes, to the
uh
sisters. Yes, y'all keep it light. There's a lot of heaviness going on in the world right now. It's been what a year it's been already. What a year January was. Keep it light, focus on yourself, stress, let's get rid of it, right? If you have questions or ever want to DM me, feel free to follow me on Instagram at real Doc Swiner. Amira, if you're there, if you can put it in the chat for me, real Doc Swiner on Instagram. I'm Doc Swiner on Facebook. I'm on TikTok. shoot me a DM. I don't mind answering a question about health and wellness. And if you're in the triangle, well, check out all the sisterhood and self-care events if you can. If you can show up in person, y'all go have fun. These are free events. Like where else can
Free,
you get
FREE free.
right? Free events where we focus on you and you get to have fun and meet some of the BGB team. But if you're in the Triangle in Durham, we're having hours on February the 15th. My good sis Sabrina Seymour with the Prevailing Pilates is going to do some Pilates. I'll be there hanging out. And we'll have some of the BGB team there, just, giving out information and samples and having a good time. So y'all check us out, take advantage, and let me know when you need me. I'm located in Durham. Yeah, I see you. I see Durham in the house.
Though this was a great time as usual. And I just want to say thank you again, Dr. Swiner, for just taking the time just to speak to us and just giving us all the good information, all the tea, everything that we need to know when it comes to understanding fibroids, because I definitely didn't have a full understanding, but now I definitely do. A better understanding, not full, but so much better, so much better. Just an understanding. So just thank y'all so much. Yes, and make sure you get your sisterhood 20 code. It's only 24 hours, y'all, only 24 hours. So please get it, use it now. But thank y'all again, and thank you so much, Dr. Swiner. Bye, guys. And then catch us again next week, okay? Next week, we have it. February 12th is going to be on PCOS. So we got some good information. So, yes, I'll chat with you all later. Bye, guys. Bye, Dr. Swiner.